Getting started with Engage Consult. So first of all, you need to download the Engage client. So this is what we are on currently. So to do this, you can go to the support article, which is on our support portal, on how to install the Engage client with Engage Consult. So all you need to do is scroll down to the bottom, click on the download, and this will download it to your desktop. So it's really important that you do not put this on a shared drive. Once you've done that, it will show as an E icon on your desktop. So click to open it up, and you should have already been added as a staff member by the Engage Consult administrator for your practice and been sent a link to set a password by email. So once you've done that, use those details to log into the Engage client. Once you've entered your details, click Login. So you're now logged into the Engage client. It's really important to make sure you have your clinical system open, whether it's EMIS or System 1, and to ensure that you're integrated. So to integrate, you would need to go to the tools in the right hand corner, select Settings, and then from the drop down list, select which clinical system you are with. Once you've selected it, click OK, and that should now connect. If you're System 1 user, System 1 will flash orange and it will ask you to approve the connection. Once that's done, that should show as connected in the left hand corner. Now you've got the Engage client downloaded and integrated with your clinical system, I'm going to show you how a patient would actually submit a request through to your practice. So they'll access a link on your website and they'll either log in to their account, they'll sign up or continue with their NHS login. So we're going to log into our account. They'll select who they want help for, so they can also do this for their dependencies. So if they've got any children or if they're a carer, they can add those as well. And then they'll request help from the surgery. They'll obviously have to confirm it's not an emergency and they're registered with your practice and in the UK. So once they've confirmed those statements are true, they can go through and either submit an administrative query or a medical problem. Now, if it's an administrative query, they get to pick between these choices, such as sick note, or they can type in something else. And it will just be free text for them, so they can type in what their query is and upload any relevant files. Once they've pressed continue, that will get sent through to the practice. And then if it's a medical problem, they can select how they've described this problem. So is it a new problem, they've been asked to get back in touch, or is it a problem with an existing condition? So we're going to click through as a new problem, type in our problem. So for example, if we had a cough, add that problem and continue through. This one has a flag, so it shows us information around coronavirus at the moment. So different conditions will have different flags. And then they get the choice to visit the NHS self-help link. So that will give them some self-help information, or they can continue through and fill in the IMH questionnaire around that cough. This will then, once they've finished that, will get submitted and sent to your practice. So now we've seen how a patient would submit their request to you. Let's see how that would come into you as a practice. So when you go back to your Engage client, you can see here we're in the requests, but the first thing we need to do is cover those corresponding groups and colleagues that we're a part of. So go to your account, select groups, and this is where you can cover particular groups. For example, if I was a doctor, I would cover the doctor group. So these will differ practice to practice because you can set your own groups. So once you highlight them blue, to any groups that you need to cover, click Save. And that now means you're covering those particular groups. But you can also do this for colleagues. So if a colleague was off ill, you could cover those colleagues individually as well. So we're going to cover Dr. Sills and click Save. When you go back to your requests, you can see under your request views, you've got all requests coming into the practice, all requests we've just covered, so those groups and colleagues, and then it breaks it down into your own requests and into those groups and colleagues we've covered. So we've got doctors, Dr. Sills, and incoming requests. So I may now want to see the requests that have been assigned to my group. So I'm going to click into the doctors group. And as you can see, I can see all the requests that have been assigned to the doctors. So for example, this top one is a sick note request for anyone. It's an admin query. And we can see it was submitted yesterday at 2 o'clock. And they've got the secure two-way messaging, so they've got an account with us. So when you click into the request, it will ask you to link the patient in System 1 or whichever clinical system you are using. So if you click search, it will now find that patient in your clinical system. So it says there's one record that matches these details. We'll confirm that's true. So this looks like the right patient. And you can now see it says this patient is matched in the clinical system. So we now need to verify that that is definitely that patient. So if you click verify patient, there's various different ways you can verify that that is one of your patients. So you could either telephone them to confirm their identity, check the information held on System 1 or your clinical system, because you can open the patient record in the clinical system from this button here. You may know them personally, completed a documentation check. So once you've done one of these, click which one you've done to verify their identity and click confirm identity. So you can now see that patient's matched in the clinical system and their identity has been verified. So now if we were going to deal with this request, as you scroll down, you'll see everything that has been done with this patient so far. So everything is logged. And then you'll see the patient's details they entered and the comment they popped in for their request. So obviously this request is for a sick note, so it's a free text comment. As we scroll back up, we may want to send a message to this patient to ask for more information. So you type in the box here your message for the patient and then click send to patient. So that will be sent to the patient's Engage Consult account and they'll get notified by email that they've had a new message from their GP in their account. So you need to click that you understand to send this message to the patient. And once that's been sent, you can see that's been added to their log and currently it is unread. So if they read that, that would change to read. So that's now gone into their account and they can now respond. But something just to note, they can't respond until you send them a message. So that means they can't bombard you with messages. You may also want to add some notes to this record. So you could type a note for yourself or for colleagues to read. So we're now typing a note and we can click add. And as you can see, that gets added to the log. But we may also want to assign this to another colleague to deal with. So what we could do is type them a note while we're giving this request to them. Click add and assign to. Select what group or colleague you want to deal with that request. So we're going to pass this over to Dr. Sills to deal with. So we're going to select Dr. Sills from the drop-down list and click assign. And you can now see that request has gone into the Dr. Sills request group. And we can see that request in there now. So if we went back into that request and we now wanted to complete this request, we can go to action and send that request to the clinical system. In here you can change the heading, the title, and you can add in some extra detail. So for example, on this one, I'm going to put sick note extended by 2 weeks. And then I'm going to select and deselect which bits I'd like in the clinical system. So you just toggle it on and off. And then you click send to clinical and complete. So this will then code it to your clinical system as an online consultation. When you open up your clinical system and go into the journal, you can see that it's been added on the date that we've submitted it. You can see it was an Engage Consult admin request and that we wrote sick note was extended by 2 weeks. It is also attached a PDF of that online consultation which we uploaded, so you can click to view that PDF. So if we opened up the PDF, it'll bring up the online consultation that was held and all the notes that came with it. That is the basics of getting up and running with Engage Consult and dealing with the requests that come through.